Guess what I'm doing? I am doing my Kegel exercises right now. But wait, how do I know if I'm doing it right? Well, we're going to learn about it today. Hello everyone, it's Dr. Nabila Noor, board certified urogynecologist and pelvic reconstructive surgeon, and welcome back to the channel. So today we're going to talk all about Kegel exercises, but most importantly, how to do them right. Yes, doing Kegels is great, but even more important is to do them right, because otherwise you're not going to see the benefits that you're hoping to get. But let's talk about what Kegel exercises are. So Kegel exercises are a kind of pelvic floor muscle exercises that help strengthen your pelvic floor muscles. Now, pelvic floor muscles is a group of muscles that essentially help support your pelvic organs, which could be the uterus, the bladder, the rectum, the intestines. And, just like any other muscles in the body, those muscles can get weak over time. And there could be risk factors like age, menopause, trauma from childbirth, and even pregnancy. And as these muscles get weak, the support of the pelvic floor is compensated. And as a result, women may notice symptoms such as urinary leakage, bowel leakage, pelvic organ prolapse. So to prevent this, it's really important to learn how to do these Kegel exercises right, because that can be a really helpful way to prevent worsening of your symptoms. And sometimes patients may actually notice improvement of their symptoms by just doing the pelvic floor muscle exercises correctly. But like I said, a lot of the times I see patients in my office who are frustrated because they've been doing pelvic floor exercises or Kegel exercises, according to them, for months, years, but they're really not noticing any improvement. And majority of the time, it's because they're not isolating the right muscles. Now, unlike your biceps or your ab muscles, these pelvic floor muscles are not something that we can just see from the outside. They're actually inside our body. So that makes it really difficult to know that you're working these muscles correctly. So very important, either you talk to your physician, most likely your OBGYN, or if you're seeing a urogynecologist, and help them teach you whether or not you're isolating the right muscles. So when I'm seeing patients in my clinic, a lot of the times when I'm doing my pelvic exam for my patients, I'll put my fingers in their vagina and ask them to use their pelvic floor muscles to squeeze my fingers. And if I feel that tightening, I know that they're isolating the right muscles. Now, to kind of explain it in simple terms, imagine when you really have to go to the bathroom, like to pee or to have a bowel movement, but the bathroom is nowhere in sight and you're really tightening down there just to hold it. That's the feeling you want. The difficulty that I sometimes see is that patients think they're using their pelvic floor muscles, but what they're really using is their abdominal muscles or their thigh muscles or their glutes to help elevate the pelvis. You don't want that. In fact, sometimes I'll have my patients put like their hand on top of their abdominal or their abdomen to make sure that the abdomen feels relaxed. Because if you're using all these other muscles, then your pelvic floor muscles are not doing what it's supposed to do, and then they're not going to be strengthening in the process. So again, very, very important to know which muscles to contract. And again, if you need, you can always ask a physician. And it's also helpful to work with the pelvic floor physical therapists. So a pelvic floor physical therapist is a specialized physical therapist who works with patients with pelvic floor disorders. They're actually very experienced and they have amazing tools like biofeedback, electrical stimulation. Sometimes, they even have patients use vaginal cones or vaginal balls to make sure patients understand what muscles they need to be isolating and what muscles they need to be contracting. Once you learn what the right muscles are and you have gotten a sense of, okay, these are the muscles I have to contract to improve my pelvic floor muscle exercises or pelvic floor muscle strength, that's when the real work starts. So that's when you start working on strengthening these muscles, which is essentially a 3-step process. Number 1 is contract, number 2 is hold, and number 3 is relax. So again, contract, hold, and relax. So when I'm telling my patients about Kegel exercises, I usually tell them to do at least 2 to 3 sets in a day, 3 is better, and do at least 15 repetitions. So again, remember the first 15, I want them to contract, hold for a second, and then relax. The next 15, I'll have them contract, hold for 5 seconds, and then relax. And the next 3, I'll have them contract, hold for 10 seconds, and then relax. And as you can see, you're essentially building up to learn how to hold that contracted muscles for a longer period of time. Maybe a little bit difficult at the beginning, but with time and practice, it will get better. Now, the important thing again about pelvic floor exercises, just like any other exercise in the body, you need to be consistent. Repetition is the key, and it does take a little bit of time before you start seeing any results. So, it's just like working out at the gym. You can't just go to the gym and have a great workout and expect to build up your muscles, whether it's your biceps, your abs, whatever it may be. Same thing. You cannot just do 1 or 2 days of pelvic floor muscles and expect that your pelvic floor muscles are going to be strong enough that you're not going to be noticing any more leakage. So please don't lose hope. If done correctly, they can have amazing results. But the important thing is to make sure you're doing it correctly. If needed, get the help, whether it's from a physician or a pelvic floor physical therapist. But let's try to continue to do our Kegel exercises because it can really help prevent pelvic floor dysfunction, pelvic floor symptoms, and for patients who are suffering from it, especially in the early stages of these conditions, can really help in preventing it from getting worse. So hope you found this video helpful, and if you did, don't forget to subscribe and talk to you soon. Bye.